One thing we know is that every person diagnosed with CTE have one thing in common: a history of repetitive hits to the head. CTE is a serious condition that needs to be taken serious in order to help prevent different disorders later in life. I will explain the definition of CTE as well as inform you of the most common symptoms and who is the most at risk to get CTE. So what is CTE? According to the Boston University CTE Center, chronic traumatic encephalopathy, known as CTE, is a degenerative brain disease found in individuals with a history of repetitive brain trauma. This doesn't mean a handful of blows to the head. Most people diagnosed with CTE suffered hundreds or thousands of head impacts over the course of many years. The disease causes areas of the brain to waste away, which then causes damage to the brain. The brain damage can cause changes in a person's thinking, personality, mood, and behavior. CTE is a very rare disease that is not well understood, and experts do not have an answer as to how many or how severe the head traumas have to be to cause the development of CTE in the brain. Another rare thing about CTE is it can only be determined by an autopsy after death. That's right, you can't be diagnosed with CTE until you are gone. But that should not stop you from knowing the symptoms and who is at risk for developing the disease. Some of the symptoms of CTE are so similar to symptoms of other degenerative brain conditions, like Parkinson's and Alzheimer's, which is why some people may never know they have the disease and may be misdiagnosed as having something else. Difficulty thinking, which in return causes you to have short-term memory loss or causes you to lose your concentration, is a symptom of CTE. It has also been proven that most the people that have had CTE have been emotionally unstable. They have gone into major depression and had impulsive behavior. The feelings of this behavior are sometimes hard for the patient to handle or control, which in some cases has led to misuse of drugs or alcohol and sometimes even suicide. CTE patients have been found to have had dementia, which in return causes paranoia. The important thing is to always tell your medical professional if you have ever experienced multiple blows to the head over several years, so they know how to best diagnose your condition based on your symptoms. After all that, you may be wondering who is most likely to develop CTE. And the answer is contact sports athletes and military veterans. Football, boxing, and hockey are the most common among the contact sports where CTE is found in the athlete's brain. Football players take several hits to the helmet, boxers are punched in the head multiple times, and hockey players fight a lot and slam into walls. Military veterans get head injuries through combat and even blast injuries. Although researchers have not found a cure for CTE, the current recommendation to reduce it is to prevent additional head traumas. Protect your head as much as possible. Now that you have heard me explain the seriousness of CTE, how severe the symptoms are, and what individuals are mostly at risk to develop the disease, hopefully we will all be more aware of how important protecting your head really is. I guess I'll take this.